Hello and welcome to the Hoover Institution's 2014 Spring Retreat. I'm Chris Dower, Hoover's Director of Marketing and Strategic Communications. Our speaker in this chartcast is Dr. Scott Atlas, the David and Joan Traitel Senior Fellow at the Hoover Institution. The title of his presentation is Obamacare, What's Happening and What's Next? And it was recorded on May 5th, 2014.
Okay, good morning. And I'm going to pick right up on the themes that John already mentioned about ideas defining a free society, and if you think government is the solution to everything, there's nothing more perfect of an area than healthcare. Now, I have a lot of material to cover here, so hopefully everyone has had their coffee and is going to speed up the process internally here. I want to first start out by framing what Obamacare is, because there's a lot of mixed information and misinformation in the media about this. There are two focuses of Obamacare. One is to increase the number of people who have insurance. And the second, an explicit focus of Obamacare, is to increase government authority over health care. And there are four general ways this is done. Number one is to impose mandates, new mandates on individuals and businesses. I think we're all familiar with this, forcing people to buy insurance or pay a penalty, and that insurance is defined by the government, and forcing employers to provide coverage or pay a penalty. The second area is regulating, and I call hyper-regulating, all private insurance, whether or not it's bought on an insurance exchange. And this is done in a variety of ways, including defining a long list of what are called essential benefits, fixing the prices of health care, and changing the way that health care is priced in general. Increasing the government's role as the direct insurer and therefore the final arbiter over access to health care. And this is done, and as I'll show you, by shifting millions of people directly into government insurance, and also doing other things to increase the authority over health care. And then lastly, to introduce massive new taxes that many of us have already begun paying. Now, already, this is the year that many of the major parts of Obamacare actually started. A series of problems is unfolding before our eyes. Insurance exchanges have had serious problems, and they're not just glitches that is kind of implies a temporary solvable thing. A lot of issues with who's actually paying or how to pay versus who is signed up. A lot of privacy issues, a lot of problems with people who are the so-called navigators helping people sign up for insurance are actually convicted felons that you wouldn't necessarily want to have your personal information. Millions of people have signed up for insurance, and this is true. However, millions of others have lost the insurance that they had chosen because it doesn't meet the definitions of the government for insurance, and therefore they have lost access to their doctors and hospitals. Insurance costs are higher. No matter what you read, and I'll show you, particularly for younger and healthier people, insurance costs are higher in more than 40 of the 50 states. Obamacare has harmed jobs and workforce participation in general, and the expenses of the law itself have exploded. These are things that are factually already happening. In response to that, dozens of executive branch delays and changes to the law have been introduced. We still have missing much information for employers as well as consumers about the insurance that we're supposed to buy, but also how it will be enforced and how the IRS will enforce those penalties. There are a series of constitutional challenges ongoing. And I think very importantly to understand, even if the law goes as designed, after a decade, 31 million Americans will still be uninsured. That is the successful implementation of the law. Now, I put in here, the law remains highly unpopular, parentheses, in the United States. It is highly unpopular, but it's amazing if you travel a lot, like I do, outside of the U.S., It's amazing how popular Obamacare is outside the U.S., in social democracies of Europe, in places like South America, where they are used to more socialism, more government, and they are shocked that most people in America don't favor the law. That's kind of just an interesting side. Now, there's another way to look at it, and that's this way, that our president said very recently, despite all of these things happening and all of the things that we know will happen, quote, "it's working." Okay, we have a difference of opinion. Now, I want to focus on the health insurance exchanges because this is a fundamental part of the way Obamacare works. There is a rationale for this kind of idea central to this law, which is that there will be a so-called marketplace online where people will shop for, compare, and then purchase health insurance. And this is something that has been ascribed to a, quote, Republican idea. And this is true. It is a very good idea in theory because exchanges like this increase competition among companies, therefore supposedly lowering prices. It improves access and improves choices for people in theory. And it facilitates the actual act of buying insurance. And these are all very good things. They do work, at least in the private sector. There are pilot private insurance exchanges that have begun. And in those exchanges, health benefits were given by employers as a package of money, basically, an amount of money. And then the employees chose how much to spend on their health insurance and what insurance they would buy, and they kept the rest. And in that kind of experiment that was done in the last 2 years, most people, 39%, chose lower cost, high deductible plans. Most people picked less costly policies and kept the rest of their benefit. And it increased the number of people who had insurance. And these are all very good results, and it just basically shows the fundamental principle that when people have more choices and are consciously spending their own money, they make value-based decisions. This is what we want. This is how everything works in the United States with purchasing goods or services, and costs come down. Now, what about the Affordable Care Act exchanges that have been in the news so much? Well, we started out by hearing all kinds of information in the press. I call it misinformation here, but I would say honestly, it's like propaganda. We saw headlines all over the country focused on California in the Washington Post. California Obamacare premiums, no rate shock here. Our friend Paul Krugman in the New York Times writes, important new evidence from California, the law's most important test case, suggests that the real Obamacare shock will be one of unexpected success. And the LA Times echoed this. This is a home run for consumers. Okay, that was in 2013. But there's a reality that is quite different that came out. And it's obvious in California, when you look at this data, and this was all derived from people at the Manhattan Institute, who did a great job showing that the price of insurance, when you compare apples to apples, was higher in California, depending upon your age, 100% or more, doubling. This is the same thing that was seen all over the country. Washington State, between 50 and 80% higher than pre-Obamacare. Ohio, 80%, 50 to 88% higher. Florida, 5 to 40% higher. Pre-Obamacare to post-Obamacare. Apples to apples. Georgia, requesting an emergency delay. And this is the map. And if you look here at this map, you see that basically everywhere other than the green states, the price went up. Apples to apples comparison. Now, this is the reality. And this is actually a reality for people who are more toward the healthier, younger age group on the left, even with subsidies. For people who are older, when they get a subsidy, it is true that the prices to them came down. But I think this is something that has been kind of falsely portrayed. Okay, they get a subsidy and the price is therefore a little bit less for some people in the exchanges. But the subsidy comes from other people. The price of the insurance went up. Someone is paying. There is nothing free here. This is not the government's money. It's your money being paid. There are other bad problems that came out with Obamacare exchanges. the choice of insurance is markedly reduced. Okay? There's a study that came out that showed that the average number of plans offered in a state decreased from 117 last year to 41. And in 16 states, 3 or fewer insurers are participating now. There is a dramatic decrease in the amount of choice of insurance. The New York Times itself did a study. 58% of rural counties have only 1 or 2 insurers. Okay, so the insurance choices are markedly reduced, the opposite to what was in theory available by using these exchanges. The access to doctors and hospitals is markedly reduced with Obamacare. In 2013, 1/3 of individual insurance offerings were categorized as having a narrow or ultra-narrow network. Okay, 1 year later, 2/3. So the access to medical care is much less, at least the choice of access, with insurance under Obamacare. And one key example here is cancer care. In the United States, there's a group of top cancer hospitals in this National Comprehensive Cancer Network. The vast majority are excluded from most of the insurance plans. Okay, so you want to go to MD Anderson, or you want to go to Sloan Kettering or Barnes Hospital in St. Louis, you're not going to be covered if you buy insurance in Obamacare. There's another thing that's happening. There's a rapid shift to government insurance. This is 2013 compared to 2018. Look at the percent changes here. 47.9% increase in people that are in Medicaid, 5.7% in Medicare just from aging. This is not from Obamacare. So the overall government-insured population in just 5 years increases by 26%. Private insurance increases by 8.7%. With a rapid shift to government insurance, you are directly controlled in terms of your access to medical care. And there's another problem with that. It's not just the control. When you shift more people into government insurance, you raise the prices of private insurance, making it unaffordable for many people in the United States. Even back in 2008, the relative underpayment for medical care by Medicaid and Medicare totaled $88 billion. Those underpayments were shifted to people in terms of the private insured population. So a family of 4 paid in 2008 over $1,500 per year extra in premiums because of the underpayment from government insurance. The point of this is the more people you shift into government insurance, the higher the cost of private insurance, and therefore it's unaffordable to the very people that the law is intended to help, the poor and middle class. There's another problem with shifting people into government insurance, specifically Medicaid. We have a massive increase in labeling people with insurance. Yes, 47% increase in people with Medicaid. That doesn't mean that that's a synonym for access to doctors. Calling someone insured is not the same as saying someone has access to medical care. Already in 2008, which is the most recent data available, 1/3 of primary care doctors and 1/4 of specialists were not taking Medicaid anymore. They were not taking any new patients with Medicaid. I don't care how many people have Medicaid, that doesn't mean anything if no doctor is going to take that. Half of doctors in specialties in a different metropolitan area survey in the U.S. did not accept Medicaid patients. There's another problem with Medicaid, and that is when you give people insurance, you expect it to have some purpose, and that is to have good health outcomes. When you compare the outcomes of people with Medicaid to people with private insurance, or even in many cases people with no insurance at all, in the variety of diseases that I have listed on the slide, and this is from the medical literature, they have worse outcomes, more deaths, more mortality from surgical procedures, longer hospitalizations, more strokes, more complications, in a variety of things, major surgeries, cancer, heart procedures, transplants. This is all facts. Having Medicaid is sometimes even worse than having no insurance at all because of the restrictions of care in people with Medicaid. There is an interesting study going on called the Oregon experiment, and this has been in the news. This is where they took a group of people, and they were uninsured, relatively poor people, and half of them got Medicaid, half of them got nothing. And what is the data from this? Well, the first study came out and said Medicaid failed to improve health beyond no insurance at all. A more recent study came out talking about this idea that, well, but people that don't have insurance, they use expensive ER usage, emergency room usage, and this is a bad situation. It clogs up emergency rooms, and it's a costly way to get care. Give them insurance, they won't do this. Well, it's factually incorrect. The group that had the Medicaid insurance used emergency rooms 40% more often than people with no insurance. There are many things that are said by people who want more government control of health care that are simply factually wrong or have no factual basis. Now, besides shifting people into government insurance and all the negatives about that, the Obamacare created something that has been under the radar, and this is called the Independent Payment Advisory Board. And this is a 15-member panel of political appointees that are created for one reason and one reason only: to reduce payments to doctors and hospitals based upon a formula. And this panel has unprecedented power because it's beyond the accountability of Congress, of the judiciary, of anyone. And even if no panel is formed, automatically the Secretary of Health has unilateral decision-making on things. And therefore, that means they can take, let's say they think that the price of an MRI is too high. They can say, okay, MRIs are going to cost $5. What do you think that's going to do to access to MRI? So, yes, there's language in here that says, well, it says we can't ration care. Okay, I mean, they're not saying we're going to ration care. They're just going to say the price of the care is going to be X. And effectively, that rations care. So no matter what you hear, that's what it does. And in fact, there's a Supreme Court process eventually going to occur to test whether this is even constitutional. This is something that really should be opposed by everyone. This is not a real political issue, you would think. And a recent article in the opinion piece in the Wall Street Journal was written that said the IPAB is essentially a healthcare rationing body. By setting doctor reimbursement rates for Medicare and determining which procedures and drugs will be covered and at what price, the IPAB will be able to stop certain treatments its members do not favor. Rate setting, the essential mechanism of the IPAB, has a 40-year track record of failure. Who said this? Howard Dean, former governor of Vermont and former chair of the Democratic National Committee. What about jobs? It was predicted in surveys that it would be harmful to jobs. And in 2013, the small business owners were polled, do you think Obamacare is going to be good, bad, or have no impact on your business? And there's a clear prediction that it will be bad by business owners. What have you already done in April of 2013 as a specific result of Obamacare? 40% or more held off on plans to hire employees. And you can see the numbers here. 19% reduced the number of employees, 18% reduced the hours of employees to part-time. This has already had, even a year ago, deleterious impact on jobs. What came out this year, more recently, was the CBO projection that really, I think, made the news and caught everyone off guard. The CBO in February said the reduction in the projections of hours worked represents a decline in the number of full-time equivalent workers of over 2 million. Okay, essentially 2 million full-time jobs or full-time equivalent jobs will be lost from the workforce. What was the reaction of the Obama administration? The White House economist Jason Furman said it gives people new freedom, liberating them from full-time jobs to spend more time with their families. Press Secretary Jay Carney said people won't be, quote, trapped in their jobs. And the New York Times weighed in saying, quote, it is mostly a good thing, a liberating result of the law. This is the media coverage of Obamacare that you get if you're not a critical thinker. Something that has not been talked about is what about the future of health benefits, the impact of Obamacare. The law was passed as we see here, the general concept here is that about 60% of employers were confident that 1 decade later, they will still offer health benefits. The law was passed, boom. A fourth of employers think that 10 years later they will be offering health benefits at all. What will it cost? When the law came out, it came in at a cost of under $1 trillion. Immediately on the next estimate, it was essentially double. What is costing so much? I'm only using this slide to show you where's the money going, okay? $1 trillion is going to subsidies for the insurance on the insurance exchanges, and almost another $1 trillion is going into Medicaid, a completely failed health insurance program that offers essentially nothing to people who have it. There's another $1 trillion going into that. It's amazing. Now, I want to make a comment about the accuracy of long-term estimates of costs of such entitlement programs. So this is a picture of the signing of Medicare and Medicaid of LBJ, who has a forlorn look on his face as he's looking through this bill, despite the jubilation of some of the others here. And maybe he was on to something. This was the estimate of the cost per adult and per year of the program. In 2008 dollars, this was the reality of spending in 2008. The numbers are irrelevant here. It's 40 times higher. 40 times higher. So what we're seeing now is the estimate of Obamacare. I'm pretty confident it's going to be an underestimate. How important is health care to American voters? It's very important. This was the 2010, just before the 2010 congressional election. Health care was listed as second only to the overall economy in terms of important. And it was thought by most people, including a lot of the people who are expert in this here at Hoover, that it was the single most important determinant in the voter's mind for the 2010 congressional elections and probably cost the Democrats the House majority. That is the analysis. How about right now? Well, it's pretty close to the same. Behind economy and job creation, healthcare is right there for how important that issue in terms of how you will vote in the next congressional election. What do voters think of the Affordable Care Act? This is very interesting. The vast majority here are unfavorable on the right side of the graph, more than favorable by age group. In fact, there's only one age group that is favorable about the Affordable Care Act, and that's the 18 to 34-year-olds. And by the data, other surveys have shown this is the one group that knows the least about the law. So this is the educated generation that is coming up here. And I have 2 sons, one in college and one about to enter college, and this is making me nervous. How about party affiliation? This is a very, very polarizing issue. There is a huge difference in what if you think it'll make your health care better or worse. If you're a Republican, overwhelmingly worse. If you're identified as a Democrat, overwhelmingly better. But the independent group, which often determines things, 39% say that this law will make your family's health care situation worse, 17% better. So there is a significant negative opinion of the law by independents. Core supporters of the Democrats are not supporting Obamacare despite the overall number. This was a piece written in July of 2013. The Affordable Care Act will shatter not only our hard-earned health benefits, but destroy the foundation of the 40-hour work week that is the backbone of the American middle class. We can no longer stand silent in the face of elements of the Affordable Care Act that will destroy the very health and well-being of our members, along with millions of other hardworking Americans. This was signed by 3 of the biggest unions. Okay, the core supporters of the Democrats. One thing is certain. One impact of this law is that it has caused new and significant fears about the future of health care. Percent of people identifying health care as the nation's most important problem has dramatically increased simply in 1 year since the implementation of the key parts of Obamacare. And I'm showing here the core constituents of President Obama. The 18 to 35 group is in green, and women, multiplied by a factor of 5, now say that health care is the nation's most important problem. Fear is the biggest result of Obamacare. I want to shift gears and talk a little bit about what is coming, what we can anticipate. And one thing that needs to be mentioned is Hillary Clinton, because I think it's becoming almost de facto that she's going to be the candidate. We'll see. What might Hillary Clinton do? Because she's saying very little about Obamacare. And that's because she's smart. Okay? You don't talk about something that is so negative if you don't have to. And the reason she really can't talk about it is because she had a plan when she ran the last time for president called the American Health Choices Plan. And that plan imposed mandates on individuals and employers to purchase insurance. It set insurance prices by imposing a specific profit margin. It expanded Medicaid. It defined coverage as acceptable or not. And it had a health choices menu where she promised that the menu would, A, include numerous high-quality private health options, would be implemented without creating a new bureaucracy, and, quote, Americans who are satisfied with the coverage they have today can keep it. This is essentially identical to what we have with Obamacare. There was one key difference, and that difference was something called the public option. And people say, what is the public option? The public option is single-payer, government-run health insurance. That's the public option. And why is that bad? Because the main result of a public option is taking a lot of people who had private insurance and putting them on the government dole. And we know this because we've had experience with this even in the United States. Hawaii had a program for children. And what happened was 80% of people that signed up for it were already insured with private insurance. They went to the government insurance, and the plan became bankrupt in 7 months when it discontinued. And there's a lot of research on this, interestingly done originally by people who are key advisors of Obama. It reduces choice of plans. It shifts massive costs to taxpayers. It limits even more your health care options. And it increases, as I mentioned, the role of the government as the arbiter over health care. That is what a public option does. I don't think that's what's going to be the end game for the Democrats. The end game for the Democrats is a single-payer system, a complete single-payer system. Why do I say that? Because, number one, it's been stated very explicitly that is what Obama wanted to begin with. Quote, I happen to be a proponent of a single-payer health care program, a single-payer health care plan, a universal health care plan, unquote. Max Baucus, who was the main architect of the law in 2009, said, quote, there may be a time when we can push for single payer. At this time, it's not going to get to first base in Congress, unquote. And Nancy Pelosi back then also said, for 30 years I've supported a single payer plan, but our next best choice is to support an exchange and a public option, which they didn't get. But it's more than just what was said at the beginning of Obamacare. It's what is going on now. The laws have already been proposed. The bills have been proposed. Representative Grijalva from Arizona asked CBO to price a public option for 2014. He said, we make sure that people don't forget this is a viable option because as the health bill is implemented, this one that we have now, more and more people are going to realize that cost containment and competition aren't as robust as they should be. John Conyers introduced a bill in 2011, improved and expanded Medicare for all is inevitable in America. It's just a matter of when it will happen, he said. Single-payer healthcare systems have successfully contained healthcare costs and provided high-quality healthcare in countries in Europe, Taiwan, Japan, and Canada, this is the grossest misstatement of everything that we have heard, and I don't have time to go into that. There's something that people have not spoken about, and that is the future of Medicare, because Obamacare really it's not a big part of Obamacare. There is a massive, rapid increase in enrollment projected in Medicare over the next 20 years and then continuing. With that enrollment increase is a marked decrease in the number of workers paying per beneficiary for the system. Because when the system started, 4.6 workers per beneficiary paid into the system. Now it's half that. When you don't have people paying for something, the system has to cover less and less. Medicare is also unsustainable financially, with a long-term unfunded liability already of $37 trillion and counting. And, of course, not unimportantly, more and more doctors are refusing Medicare now. Already, 20% of primary care doctors see no Medicare patients, and 10% of specialists see no more new Medicare patients. Enrolling people into a health care plan that does not provide access to health care is fraud. In fact, the most recent survey said over 52% of doctors have already limited access that Medicare patients have to their practices or are planning to do so in the next 1 to 3 years. Medicare and Medicaid is projected by before 2050 to take up all of the incoming revenue of the federal government, all of the tax revenue. There will be no money, if things keep going, for anything, including national defense. Nothing. Yet Obamacare does nothing about costs. Now, what might happen? And here, this slide is if Obamacare takes its course, if things are not dramatically changed. It will be disastrous. It already is, and it will be modified hopefully piece by piece. It will become accepted as a new entitlement program. It's extremely rare for an entitlement program to be just repealed and taken away. There's no doubt in my mind it will serve as a basis for further government control, not just for a public plan, but also for even possibly forcing doctors under threat of no licensure to accept the public plan reimbursement. This has been contemplated in the great state of Massachusetts already. And ultimately, and very sadly, this will lead to a markedly separate two-tiered healthcare system where everyone with money or power will avoid this system just like it's done in every other country with government-dominated health care, including the National Health Service in the UK and everywhere else, where the ultimate result is only the poor and middle class suffer the full consequences of this system. The great irony of Obamacare. I just want to finish up with 2 slides here. No matter what you read and how many times it's emphatically said, there are other proposals. It is not true that it's just repeal and no plan. What's the plan? There have been more than half a dozen GOP proposals. These all focus on costs and maintaining excellence. They reform private health insurance markets with a variety of things that are kind of obvious, low-hanging fruit, allowing people to buy insurance in these less monopolistic situations, stripping back the mandated requirement coverages, introducing substantive tax reforms, reducing, not increasing the government's role as direct insurer, and using the government's power appropriately to force transparency of price, transparency of information. If UCSF and Stanford were forced to post their prices, the prices would come down. There's no question about that, even though a third party is paying. And fixing the medical liability system. John Cogan, George Schultz, and I wrote a piece recently that talked about what we believe is the essence of health insurance reform. And that is to reinstate the essence of health insurance itself back to the intended purpose. The purpose of insurance was never to pay for every part of health care from $1 or near $1. It was to reduce risk for significant expenses for unanticipated health care events. That's what insurance does. And to transfer a system of insurance to individual ownership with a lot of ways to do that. But basically, this allows people more choices, tax fairness, portable insurance, and incentives to shop for value while reducing costs of health care, which, by the way, is the single biggest reason to do reform at all, is the cost. Nothing to do with the rest of these things that Obamacare does. And we'll finish with that. Thank you very much.
I'm Chris Dower for the Hoover Institution. Thanks for listening. For more information about the Hoover Institution, please visit hoover.org.